This video lecture is going to discuss pigment disorders in the skin. Now, remember that within our epidermis, we have those melanocytes we talked about back in our tumors. The melanocytes are going to produce the dark brown melanin pigment that helps to protect the nuclei of our keratinocytes from UV damage. And so they'll be scattered throughout the epidermis, and as we suntan, they will produce more of that melanin, causing more of the keratinocytes to get darker and darker and darker. When ultraviolet rays hit hard enough to cause those cells to make more and more melanin, another reaction is that the melanocytes themselves may reproduce more in order to keep up with the demand. Now, pigment disorders are going to occur when something interferes with, or something malfunctions, I should say, with the proper formation function of those melanocytes. Now, with pigment disorders, we can either have too little pigment or too much pigment. Albinism is a hereditary lack of melanocytes, and so they simply lack any functional melanocytes in the epidermis. Their skin is otherwise normal and healthy. They simply don't make the melanin pigment. And so they have very pale skin. The melanin that normally gives the brown to the iris is gone. So you see the red blood vessels underneath. The brown in the hair is gone. And so these individuals are very fair skinned with the very light colored eyes. Otherwise, totally healthy, everything's fine. They have to be more careful about exposure to sunlight because they have no melanin protection, but it's fine. This is hereditary from birth, head to toe. Conversely, vitiligo, V-I-T-I-L-I-G-O, vitiligo, this is a progressive condition that occurs usually around puberty. It causes a progressive loss of melanocytes within patches of the epidermis. And so this would be the normal skin color of this patient. And then the areas you see up along here, the melanocytes have simply shut down. And so again, the rest of the skin is totally healthy, but you now have lost any pigmentation in any of this skin. And so usually happens around puberty. We think it's some kind of hormonal reaction causing the melanocytes to just shut off in groups. And the pattern varies from person to person. This young lady is a professional model who has used that to make a characteristic pattern or brand, I should say. So make sure you understand the distinction between albino and vitiligo. That's reduced pigment. We have increased pigment. We've got things like ephelides. Now, ephelides are going to be these acquired freckles that occur due to sun damage. And so the individuals we see here were exposed to so much sunlight that it caused these melanocytes to overreact and make extra melanocytes, creating little clusters that make little dark spots and form this freckling appearance. Ephelides will occur in clusters, like you see along that little boy's cheek, and for the young girls, pretty much everywhere. And you can even see Morgan Freeman is a classic case of the ephelides all along his face as well. Lentigines are going to again be these acquired freckles, but these will usually occur singly. Now, if you get exposed enough times, you'll get many, many of them, but each one is an individual pathology. And so you can see a person like this who has all these individual lentigines. These didn't all happen from just one afternoon of suntanning. This was a person who's been exposed to sun for decades without enough proper protection, has burned each one of those. I mean, all of us, at some point in time, you're going to get a couple little dark spots on the skin that are going to show up. And so those are totally benign, simple little structures that have developed, they've acquired because of sun exposure. But individual ones at a time, those would be lentigines. If I had a sunburn across the arm and I was done with freckles all over it, then that would be the ephelides. Melasma, now this is a hormonal induced pigment change. Very commonly, we see this either in females mostly, and we see this in reaction to menstrual hormones or pregnancy. You'll see this brown pattern along the face and the upper torso, and it'll become dark for periods of time during, as I said, during certain periods of the menstrual cycle or pregnancy, and usually fade away afterwards. So some kind of hormonal reaction causing these melanocytes to go a little nuts and then go back to normal afterward. I also want to talk about birthmarks for a second. Now, we've talked about the hemangiomas that cause blood vessels to cause pigmentation issues, but you can also have pigment birthmarks, and that's due to pressure in the womb. And so this gentleman here, you can see right where his forehead was leaning against mom's pelvis when he was inside the womb, pushing on that forehead enough, the body reacted by trying to grow a little extra skin in the area, and in this case, some extra melanocytes for no reason, but they did. And so they grow a mass of these, and so he will have a permanent dark spot right there. For this little baby, we can tell that they obviously were leaning, the back of the skull against mom's pelvis during third trimester, and the body responded by growing a whole lot of extra melanocytes. So when someone mentions a birthmark, make sure that you distinguish between a vascular birthmark, a hemangioma, or a pigment birthmark. All right, that's our pigment problems, too much or too little. Very straightforward. Flashcards are good for this chapter. Take your time, practice your spelling. Get scratch paper. Lots and lots of practice spelling. Good luck.